CMS has updated the CPT codes for Transitional Care Management for 2025. In this video, we'll discuss everything you need to know so that you can properly code and bill for this program. Hey there, this is Jake from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like TCM with our care coordination software. If you'd like a reference guide for the TCM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. In CMS's 2025's final rule, there was no major changes to TCM's rules and regulations. However, for the first time, rural health clinics, or RHCs, and federally qualified health centers, FQHCs, will be able to bill using the TCM fee-for-service CPT codes. Also, updated reimbursement rates for CPT codes have been introduced. Please note, these codes are based on national averages, which may vary by location. To find the exact current rate for your area, please visit the Physician Fee Schedule website. Transitional Care Management supports patients during the first 30 days after their discharge from the hospital. The primary goal is to ensure that patients avoid readmission and are successfully transitioned back to their homes. If a patient is not readmitted after 30 days and all three components of TCM have been completed, interactive contact, non-face-to-face services, and an office visit, then billing can begin. There are two CPT codes for Transitional Care Management, determined by the complexity of medical decision-making. Only one code can be billed per patient in each program based on complexity. So what exactly goes into determining the complexity in medical decision-making? Complexity can be determined by how many possible diagnoses and/or the amount of care management options needed to be considered. The complexity of medical records, tests, and other information that needs to be acquired and analyzed, or the risk of significant complications with the patient's condition. It's ultimately up to the provider to determine the level of medical decision-making and to bill one of the following codes. The first CPT code to note is 99495, which pertains to moderate complexity in medical decision-making. The patient must be contacted within the first 48 hours after discharge, and a face-to-face office visit should occur within 14 days of discharge. The national average reimbursement for a claim with this code is $201. Another option is to bill for high complexity in medical decision-making using code 99496. The patient must be contacted within the first 48 hours of discharge, and a face-to-face office visit should take place within 7 days of discharge. The national average reimbursement is $273. One point we didn't mention is the low complexity of decision-making in transitional care management. Although you cannot bill for low complexity cases, we at ThoroughCare strongly recommend that you still complete a TCM for these patients. Even though billing is not possible, having a completed TCM will help ensure a smooth transition home for your patients and enhance the value-based care service your practice offers. So there you have it, the 2025 updated CPT codes for transitional care management. If you'd like to learn more about TCM, its rules and regulations, or its billing codes, watch more videos on our channel or visit our Learning Center. There's links in the description below. And don't forget to download your free reference guide for billing codes we discussed in this video. Please like and subscribe, and thanks for watching.